Hey, what's up, everybody? Jed Johnson here from dieselcrew.com. Of course, you know they call me Napalm. I'm up here at Jim Wagner's house in Elmira, New York, and he's going to look at my shoulder today. I've been having shoulder issues. I can't even remember how long it's been. It's probably been 3 months. So, and you know what I think? It was when I was trying to clean the inch dumbbell.
Yeah.
The inch kept smashing into my chest. It screwed my collarbone up. There was a big lump on it. And I think the tightness from that trauma created an issue where it threw something off track. So I personally think it's the bicep tendon that comes up.
Okay.
But it could be a little deltoid too. My chest, my chest was messed up. I know like the connective tissues that were like around the collarbone were messed up, and I think it kind of accumulated over the course of a few weeks, and that's what happened. So.
Well, one of the things we'll get into here in a second is we'll take a look. A lot of times, especially all the curls and the pulling and stuff you do, these anterior muscles, the long head of the biceps, short head of the biceps, that short head comes here, the long head goes into the labrum. That'll kind of get pulled on and pulled forward, and then a lot of times it's an unequal balance between these anterior muscles and anterior deltoid and the posterior capsule. So if we can get in and see if we have some mobility issues, and it might be just the straw that broke the camel's back, you're pulling a lot of weight. So, that might have just been enough to kind of traction out, to put some tension on it. We'll see if we can get in and loosen that up and find out what the problem is. So
you make a good point, because I think in my body training, I'm balanced. But the grip training throws everything else off, because I'm constantly creating tension like this. And like I'm sure the chest is shortened, everything in the upper back is stretched out and weaker. Just from that tension imbalance. So
it only takes a second for even awful, like a different breathing pattern or just a little bit of relaxation here and then a pull in one particular area. There's so much force in those biceps, even though they do a lot of work. They're not where a lot of the strength comes from. So a lot of times those just get overworked because of all the pulling. Even like the strict curls and stuff like that, we see people get kind of injured and stuff like that. But there's a lot of like anterior bicep issues and stuff like that. They're usually, this is the area that talks to you, but the problem is elsewhere.
Okay, that makes sense.
So let's take a look and see what we got. So you mind taking this off for a second? We can do that. So you might get naked.
I try not to destroy your fan while I take my shirt off.
Good. All right. So let's take a look here just for a quick second here. Where's most of your pain at, Jed, then?
So right now there's very little pain.
Okay.
But like what I would say is there's an alarming clicking that takes place, and it's right in through here.
Okay. All right.
Right in through there.
So a lot of times there's right along the long head of the biceps that comes up. The short head goes right to the coracoid process, which is right in through here. Any tenderness right there at all?
No, but there was
some
when it first started.
Long head comes right up and through here, and it goes to the superior portion of the glenoid rim. Your acromion is right here, and so that supraspinatus comes right about a 45-degree angle and inserts right in through here to the greater tuberosity. So the long head comes down and through here. So I'm going to run my fingers right across here and just see, is there any pain or tenderness there at all?
No, but there definitely would have been like 2 months ago for sure.
So if you hold your arm there, I'm just going to kind of pull out for a second. Don't let me do it. Hold right there for a second. Anything there at all?
Just a little click.
Okay, so a little click. So along the head of the biceps, there's a little ligament goes across here called the transverse humeral ligament, and sometimes that can get in pain, or that can get aggravating along that hair. But let's take a look and see how this back of your shoulder's doing.
Okay.
Can you put your hand behind your back like you're tucking in your shirt? All right. So I'm going to really bring this arm in here. Okay. You let me know if you notice anything. I'm going to try to pull your arm off your back, and I can't even move that right there. Any pain with that at all?
It's too tight, so I felt pain, but nothing like this.
Bring your other arm behind your back right here. Take this right out of there. So I'm going to bring it a little closer. And I've got a little bit more play right there. So I've got a little bit, maybe 3 or 4, maybe about 3 inches from that right there. Okay, so what that's telling me is that we've got a posterior superior capsule issue right in here so far. So let's do this. Let's go ahead and lay on your side right here for me.
Lay
on your left side, with your arm kind of like you're gonna, if you're at that sleeper position, that modified sleeper stretch you talked about.
Okay.
So let's go ahead and measure here for a quick second. So we're gonna bring you right here. So what I'm gonna do is I'm just gonna check and see how your internal rotation is right here. Can you don't push it to stay right about there for me. Okay, that's good. You can let go just for a second and see if you can hold it there. So we've got about 40 degrees internal rotation on that side. Can you lay on that side over there for me? Now I'll bring this one on the inside, bring it down. Oh yeah, look how much farther you can get with that one over here. So we've got about 55 degrees on that side without even putting a lot of pressure on. A little bit of pressure. So we got 40 on one side, 55 on the opposite. Go ahead and sit right back up for me. So we'll do a little bit. So no cervical issues, nothing that radiates from the neck down to your head or your arm like that at all?
Well, so at King Kong, which was the last Saturday in October, I was doing this left-handed lift, and the last 2 attempts, I could feel a pinching at like the base of my skull, maybe a little bit lower. So that was another form of training that I was doing that wasn't inhibited by whatever injury I had, but I started feeling stuff in my neck. So other than that, since then, nothing.
But it didn't radiate down your arm, didn't reproduce the symptoms you have right there?
No.
Okay. So bring your arm up in this position here for me and relax. Put your arm right here. So we're going to hold your arm just like that. Okay, is that painful right there?
Yeah.
So we got a positive they call the Hawkins-Kennedy right there. We're going to do an empty can test. So turn your arm down for me just like this. I'm going to push down, don't let me do it. Pain with that. Hold it there again for me. Now bring both arms in like this for me. I'm going to push down, don't let me do it. Pain with that on this side at all?
Not pain. I mean, there's
you
something.
Feel it pulling.
Yeah.
Bring your arms up like this for me. Now we're going to do external rotation. We're going to manual muscle test you here. Hold your arms just like that for me. I'm going to push in, don't let me do it. You ready? Okay. So it was external rotator. So bring them down by your side. Put them right here for me. I'm going to push in, don't let me do it. You ready? Stronger down here, but boy, I'm on your side, so we got to get these back in through here.
Yeah.
So let's come out here. Let's do a drop arm test. I'll come out here to this side right here. Hold your arm just like that for me. I'm going to push down. Okay. Bring your arm back down for me. So now what I'm going to do is I'm going to come up in this position right here. Hold it just like that for me. I'm going to push down. Don't let me do it. Any pain with that at all?
No.
Okay. No pain at all then, right?
No.
All right. So let's take a look at how your shoulder blade's moving and stuff for a second. We're going to do what they call a scapular dyskinesia test. So if you'll stand up for a second, and then we're going to have you face that direction of the wall right there. So let's go ahead and face right here. Now, usually we have short people in my house, so I'm a guy your size. So let's go ahead and step to your right just a little bit for me. So what we're going to be doing, we're looking for your inferior angle of your scapula right here, okay? You're really big in through here. We're going to look at lower trap. We're going to see how this muscle called the serratus anterior works. So with your thumbs up, I want you both arms over your head. Raise your arms over here a couple times, and then back down for me. Back up, back down, back up, and back down. Okay, relax there for a second. Now what I'm going to do with just one, I'm going to have you just that one arm. I'm going to put a ball in that hand. It's a weighted ball. Thumb up for me. Okay, just go ahead and raise both arms over your head for me 3 times.
There's definitely some clicking going on.
Okay, some clicking into there. So everything looks pretty good. What I'm looking for is this inferior angle. If this medial border pops out or inferior angle comes out, but it's staying where it's supposed to, Jed, pretty good. Big lats, big upper traps. I think down here, this lower trap area and stuff like that could be a little fuller than what you have. I mean, just again, just because you got so much force and so much power up here. So, but more than likely, there's probably an imbalance between these upper trap, lower trap, and a little muscle called the serratus anterior. All right, so come on over here. Let's have you lay on your back for me 1 second. So go ahead and lay on your back. Okay. Arm up straight to the ceiling. Make a fist for me. Now, like you're doing a push-up plus. You're raising that forward, shoulder off the hip. Up. Okay. Up again a couple times for me. Just like that again for me. Up. One more time and come up. Hold it there. I'm going to push down. Don't let me do it. Good. Now on this side over here, same thing. Up and down, push-up plus a couple times. Down. Hold it for me for a second. I'm going to push down. Don't let me do it. Good. Okay. All right. So now we're going to check your lats. Okay, you see how tight they are. So scoot down just a little bit for me. So a lot of times, the latissimus, because being so broad and so thick and big, will limit little overhead elevation. So what we're going to do here first is lay your legs straight. Because when we lay this leg straight, what that does is brings your pelvis down and relaxes the lat a little bit here. Okay. So I'm just going to go ahead and see your overhead mobility is here. Good mobility, Jed. Looks pretty good.
I can feel tightness though. When you get down to the table.
Can you feel it down there?
It's
okay. So let's go ahead and bend your knees now for me. What that does is it rolls up that pelvis and bring them in tight for me and drops that in more of a posterior pelvic tilt like that. And then, okay, but not too awful bad.
About the same.
About the same, not too awful bad. Okay. So come on back up here for me. Let's sit around the edge. So kind of what that is, that screen in there really quick. I definitely think, like you said, is it's probably more of a long head of the biceps irritation and stuff like that over here. But more than likely, I would say it's due to a posterior capsule So when you bring your arm across your chest, can you do that for me? Is there any tightness or pain there?
Oh, yeah,
that?
Okay, definitely.
Do you feel any pain up front here at all?
No.
But you feel a lot of pull and a lot of tension back there.
Sure.
So usually it's when guys have a hard time getting their hand behind their back, they can't lift it off, or when they bring their arm across your chest. So if this capsule that helps the stability of the glenohumeral joint is restricted posteriorly, when they go to upperly rotate, and this acromion is right here, what happens is if these muscles are so big, which you have big anterior delts, big pecs and delts, those big movers, what it's doing, if these are restricted and shortened, and these aren't strong enough, these external rotators that help with this back and through here and the good lat mobility, it'll pull these structures forward. So when you're probably pulling that, I don't know how you got inch dumbbell, which is how much?
170.
Yeah. So it's probably just put an abnormal amount of stress and strain in the long head. So what I would probably say is we can focus on some posterior capsule stretches. So maybe a sideline sleeper stretch as long as it doesn't pinch up front. Maybe some behind crossbody posterior capsule stretches in that position. Some lat mobility, which you don't need a whole lot. And then just strengthen these external rotators.
Okay.
If we can do that, we'll set that head of the humerus back in the glenoid labrum better. So the whole idea behind those four rotator cuff muscles, so supraspinatus, infraspinatus, teres minor, and subscapularis, those four muscles in there, is to center that head of that humerus in your glenoid labrum. So these big muscles can do their job. These big muscles move the car, move the shoulder. It's those four small ones that drive it. So if these get too big, and those rotator cuff muscles they don't get have enough endurance or enough motor control in them, with some kind of force, like you're pulling that huge amount of weight like that, it's going to be just enough to kind of torque the system a little bit.
Yeah, okay, that makes total sense, dude.
So let's go over a couple things, and we'll give you some. So the test will become the homework. So we'll do a sideline sleeper stretch, we'll do a crossbody adductor stretch, some lat mobility, and then we're going to do some external rotation stuff. And so is it painful when you press them? Is it painful when you do pressing exercises? Like
no, I just pressed last night. It wasn't too bad.
So nothing like overhead bench press or anything like overhead press, strict presses, those things?
Not on my shoulder and not in this area. My elbows, like my insertions on my tricep have killed me for 2 years.
All right.
So I don't know, but as far as doing the exercises, no.
Yeah. Okay. Well, that's good. So maybe it's just more than an isolated overuse. It's about an unequal load ratio. So it wasn't that your muscle couldn't take it. It's just it overloaded it at that particular thing. And so what we do to get back into it is find an entry point where you can continue to exercise. A lot of times the docs and stuff will say, "Oh, just go ahead and lay off. Don't do anything." But we know that it's guys like yourself, we're not going to completely give it up.
Yeah.
So you're going to find an entry point to get back in, so you can continue to train. That's not going to aggravate the tissue. We're going to dose it differently. So
yeah. I can tell you that if just the other day I demonstrated W's. So like we lay on an incline bench on the belly and then do W's with light dumbbells, 5s, 8s, something like that.
Right.
When I do that, I do 2 reps because it hurts.
Yeah.
And like just doing that right now, when I set my arm back down, it was clicking.
Yeah. So that clicking, a lot of times it's clicking shoulders. Now what it is that can be just that bicep, or that bicep runs that intertubercular groove there. And so when we go into external rotation, if it's swollen or aggravated, it clicks in and around that right there. So a lot of what we do is we're going to strengthen below 90 degrees. Okay. So when you come back in that Y, that's a really good exercise. You come back in the Y, it's great for external rotation, but the problem is it irritates up front here. So we're going to strengthen posterior delt, lower traps. There's a great thing I just saw that I love them on Squat University. It has the Lock 3 exercises, which are great for anterior shoulder pain. So you're working on scapular retraction. So you're working with the thumbs down, with the thumbs up here, and then so you're working on rhomboids, and then you're working on your prone T's in this position.
So that's your 90 degrees and down.
So 90 degrees and down. So a lot of times people will say, "Oh yeah, I'm going to do my external rotation." So they'll start coming up here and doing all these band and face pulls and stuff like that. Now they're good. And they're excellent to do, but you're just going to start to do them at a position below 90 degrees to where you're not going to get in and start to click. Okay. And then if you're going to do that external rotation, you can do that. But if you come out to here, let's say here, and it starts to click, you're going to go just before that. Maybe drop down 10 degrees.
Yep.
And then iso holds are excellent. So there's nothing better than isometrics. And there's some things I'll show you here in a second. And a friend of mine, Dr. Eric Keene, who...
So you're talking about doing one of the movements, but holding it in that position?
Isos are awesome, yeah. And I'll show you this thing really quick. This little sucker right here, I use this all the time. It's called the handlebar, and it's like an isometric strengthening exercise. And there's like 3 or 4 good things that isometrics provide. So there's like short-term analgesics, tendon healing properties, increasing blood flow, and it loads the tissue. in a submax area to prepare you for movement. So this is a simple little thing that he has used, and his name is Dr. Eric Keene, and you can find him on Instagram and stuff like that. But he's got some great stuff on, and I use this as a preparatory load mechanism before I even start my upper body or squat workout. So submax isos, we'll work with those, and that'll help put some tissue in, or tension in the tissue under an area where there's not as much pain, so you're able to move better when you get ready to put the loads on you again. So, but let's get into some treatment.
Yeah, sounds good.
All right.